Greetings everyone. In this lecture we are going to cover chapter 20. So we're going to be discussing diseases of the eyes, ears, and respiratory system. So we're going to talk about common types of infections associated with each of these, as well as the pathogens associated with each of them. And then we will talk about some preventative measures. In this lecture, we're going to be focusing on one component, aside from eyes and ears, is the respiratory system. And now more than ever, we have this hyper-awareness of diseases that are transmissible via coughing and sneezing. And that used to be flu season, right, that we were most concerned with. And, you know, making sure that we don't come to work sick and making sure we wash our hands and avoid close contact and those types of things associated with the flu. So now we have this COVID-19 pandemic, and it is equally important for us to utilize those same measures during that we utilized during the flu season to utilize them now. And I am glad that we have this time that we're going to be spending together in the lab so that we can make sure we understand how to wear our PPE properly, as well as how to remove it properly. That's going to be one thing that is really going to protect us when we go out into the operating room and are exposed to a variety of different diseases. The most common type of disease involving the eye due to bacteria is conjunctivitis. And conjunctivitis, we also call that pink eye. And pink eye is inflammation of the conjunctiva. It's like this really thin covering of the entire eyeball. And it can be caused by bacteria or viruses. And those that are the most common as far as bacteria goes include Staph aureus, Streptococcus pneumoniae, Haemophilus influenza, and Pseudomonas aeruginosa. Typically, this presents itself with a thick white gummy discharge like you see in this image here. The individual might wake up and they can't open their eye because their eye is literally glued shut. It may take a hot compress to actually get that eye open. If any of you have ever had pink eye, you know, it feels like you have sand in your eye. It is not a fun feeling, and it is highly communicable. If you have it in one eye, there's a good chance that before you're done, you're going to contaminate the other eye, sadly. Typically, we treat this with eye drops or ointment. Pseudomonas now can cause it in conjunction with the conjunctivitis, keratitis, which is inflammation of the cornea, and this can lead to blindness if it's not treated properly. Also, if you wear your contact lenses for longer than you should, this can lead to something called giant papillary conjunctivitis, and this causes red bumps, itching, tearing, and a heavy discharge. You should discontinue wearing your contacts right away. Viral conjunctivitis, we also refer to that as pink eye. It's highly contagious, airborne, caused by airborne viruses. Again, we get discharge from the eye. Unfortunately, antibiotics can't really treat this because it is a virus, so they may prescribe some sort of anti-inflammatory or some sort of vasoconstrictor. Non-infectious conjunctivitis is also referred to as pink eye, but it is more likely caused by environmental irritants. There are also allergies that can cause conjunctivitis, and oftentimes this is taken care of by over-the-counter eye drops or allergy medications. A syndrome called Stevens-Johnson syndrome is a syndrome that is characterized by an unusual or unexpected reaction to a food, drug, or other substance. We refer to that as idiosyncratic. Some signs and symptoms include erythema, edema, sloughing, blistering, ulceration, and necrosis. Signs may be inflammation of the eyelid or blepharitis, conjunctivitis, and keratitis. In regards to neonatal conjunctivitis, now a lot of times these ear, nose, and throat situations are most frequent in pediatric populations. So when we talk about neonatal conjunctivitis, we're talking predominantly about those diseases that are caused when the baby passes through the vaginal canal. And if mom has something like gonorrhea or chlamydia, this can be transmitted into the baby's eyes. And that's why we routinely treat with antibiotic therapy as soon as baby is born. Chlamydia trachomatis can cause something called trachoma, and that causes scarring on the surface of the eye and results in blindness. And trachoma is the world's leading cause of preventable blindness. Moving on to ear and nasal infections. Ear infections are typically caused by Pseudomonas. Pseudomonas has been identified as the cause of otitis externa, so inflammation of the outer ear. If you've heard of swimmer's ear, that's what we're referring to here. So individuals, children that spend a lot of time in the pool during the summer are often diagnosed with swimmer's ear. It's itchy and painful, but not doesn't really present any complications, and topical antibiotics is typically the way that they treat that. Malignant external otitis is more virulent form of ear infection, and we find this more commonly in elderly individuals and those with diabetes. So again, compromised immune system, I'm thinking here. It can penetrate the mastoid bone, which is the bone where that has the hole going through it for the ear. The bony part, the middle ear, is in the mastoid bone, and as that progresses, it can damage the 8th cranial nerve and is life-threatening. So aggressive antibiotic treatment is what is suggested there. They could also have to have surgery as well. Other bacteria that cause middle ear infections are Staph aureus, Staph pneumoniae, Strep pyogenes, and Pseudomonas aeruginosa, and Haemophilus influenzae. Otitis media, again, meaning middle ear infection. What happens here is the middle ear is just an air-filled space, but sometimes when an infection occurs in there, then pus accumulates in there. This is what causes pressure against the eardrum or the tympanic membrane, and that is where, if we can't clear it up with antibiotics, then we might have to perform a laryngotomy and put in some of those PE tubes. Now, typically little ones develop this more because their immune systems aren't fully developed, and because that eustachian tube that connects their middle ear to their throat, their pharynx, is smaller and more easily obstructed by pus and bacteria. And so some signs and symptoms would be fever, pain, flattening of the tympanic membrane, scarring of the tympanic membrane, a potential perforation of the tympanic membrane, and developmental delay in children with recurring otitis media. Nasal and sinus infections barely get a tiny little shout out in our book here, and the culprits are typically Staph pneumoniae and Strep pyogenes. What happens is these bacteria cause sinusitis, which is inflammation of the mucous membrane that lines the sinus tract. And as the membrane becomes inflamed, then the flow of mucus is blocked, and this can cause pressure and pain and discomfort. Antibiotics are typically used to treat this, but untreated infections are knocking on the brain, and as a result can be easily transmitted from the sinus to the brain. As I like to call it, the respiratory system is a common site for infection, and that's just because it is exposed to everything that is in our environment that we breathe in. Thankfully, it does have these specialized cells that act like this escalator that are continuously pushing invaders up and out. So just think how at risk we would be if we didn't have that system working for us. So anyways, diseases can be viral, bacterial, or fungal. They can be mild to life-threatening. They can affect the upper respiratory tract, and they can affect the lower respiratory tract. So what do we have living here? We have resident microorganisms that are, the friendlies, and then we have transient opportunistic pathogens, and there is a long list of them. To include Streptococcus pyogenes, Corynebacterium, Neisseria, Mycobacterium, Bordetella, Brucella, Legionella, Mycoplasma, Chlamydia, Pneumocystis, and Histoplasma. Now we have some friendlies that are living there that include Staphylococcus, some species of Neisseria, Strep, Haemophilus, and Micrococcus. There's also some spirochetes and some yeasts kind of mixed in there that are helping us out. As far as bacterial infections, the most common for the upper respiratory tract are laryngitis, tonsillitis, and pharyngitis. And Strep pyogenes is the most common bacteria that causes infections of the upper respiratory tract, and so that's why we typically refer to pharyngitis as strep throat. Now, streptococcal pharyngitis is caused by the strep pyogenes. It is an acute bacterial infection of the throat or pharynx, and it results in fever and pain. The tonsils are often involved, and we see these little white plaques that are characteristic of strep on the tonsils, and you can see that in this image here, the one labeled streptococcal pharyngitis. Let's see, the bacteria can also travel to the middle ear, resulting in otitis media. Can also cause secondary complications if it's left untreated, such as rheumatic fever and glomerulonephrosis. It is transmitted from person to person via direct contact or aerosolized droplets or in saliva. It is identified by standard throat swab and laboratory culture and sensitivity. Tuberculosis, we already talked about in chapter 14. Tuberculosis is an acute or chronic mycobacterial infection of the pulmonary tract. It's typically caused by Mycobacterium tuberculosis. It can survive for weeks in the sputum, then they're not affected by many antiseptics and disinfectants. So only need a couple of these little suckers to get down into the lungs, and then they can proliferate and wreak havoc. If there is a caseous form, then this means that there is liquid that forms in the tubercle. The bacilli begin to spill out, and they begin growing outside of the macrophages that typically engulf them. And then this makes it increasingly communicable because of that. Moving on to diphtheria and whooping cough, or pertussis. Diphtheria, we've already talked about before, and pertussis as well, I believe, in chapter 14. However, remember, diphtheria is caused by Corynebacterium diphtheriae, and it produces a toxin which increases its virulence. It can be transmitted through aerosol droplets, direct contact, or fomites that have been contaminated with the bacteria. These bacteria stick to the specialized cells of the respiratory system and they destroy the cilia. This causes like this grayish film to form, and as the individual coughs, they will eventually begin to cough up that membrane, but the development of that can obstruct the airway. Also, you might see inflammation of the cervical lymph nodes in these individuals. Whooping cough caused by Bordetella pertussis was identified in 1906, and it's acquired by inhaling droplets of an infected person. It is highly communicable, and prior to the development of the vaccine, it was a devastating disease. Disease in the United States peaked at about 1934. There are 3 stages of pertussis. The first one is called the catarrhal stage, and that kind of begins with cold-like symptoms and progresses to the paroxysmal stage, which is where the violent coughing attacks occur. And this sound that is made due to this violent coughing is where it gets its name of whooping cough. Then there's the convalescent stage, which is most of the symptoms start to abate. Complications that can occur during the second stage include broken ribs, rectal prolapse, and severe difficulties in breathing that may lead to the individual needing to be placed on a ventilator. Can also cause otitis media and the little ones. Bordetella parapertussis is a milder form of whooping cough, and then Bordetella bronchoseptica is what we refer to as kennel cough, and it occurs in both dogs and cats. The diagnosis is going to be obtained through a culture, and I found it interesting that they don't use cotton swabs because the cotton fibers inhibit the growth of Bordetella species, so they insert a swab that's on the end of a wire through the nose into the nasopharyngeal tract, and it is left in there while the patient proceeds to cough. That does not sound like a fun time to me. Once a diagnosis is made, then antibiotic therapy ensues. The CDC recommends that pregnant women should be vaccinated with Tdap every single time they are pregnant. Other recommendations for vaccinations include infants and children at ages 2, 4, and 6, between 15 and 18 months, and between 4 and 6 years of age. Also children 7 to 10 years of age, 11 to 18 years of age, and adults older than 19. Also, all of us healthcare workers. Outside of the United States, sadly, pertussis remains one of the leading causes of vaccine-preventable deaths. Next on our list to discuss are the common cold and influenza. The common cold. Half of all colds are caused by the rhinovirus, 15 to 20% caused by our friend, the coronavirus. Colds become fewer and fewer each year as we age, right? Because our immune systems become more developed, and then unfortunately there's a time when our immune systems start to decline with aging, so we might see that pick up again. Typically a cold is spread through aerosol droplets. The virus is going to implant itself in the nasopharynx. It attaches to the host cell's cilia in the respiratory tract, and if it reaches the middle ear, it can cause otitis media, or if it reaches the sinuses, it can cause sinusitis. Influenza, we refer to this as the flu, It's dangerous and common. It can cause fever, chills, cough, headache, and muscular pains, body aches. Many are killed every year by influenza. It's typically those that are aging, have underlying diseases, or are immunosuppressed. It likes the cold months, so it thrives during the coldest months of the year. A common characteristic of fungi is that they produce spores, and those spores can become airborne and then they can be inhaled. And that's what's going to lead to a fungal respiratory infection. They're not very uncommon. There are situations such as histoplasmosis, coccidiomycosis, and blastomycosis. What you're looking at here on this image is the result of histoplasma capsulatum, which causes histoplasmosis. And this disease, as well as the coccidiomycosis, both resemble tuberculosis. Histoplasmosis can resemble mild respiratory illness, but the fungi can spread to through the lymphatic system and to the circulatory system and to other organs as well. Typically, it's transmitted through bird and bat droppings. Coccidiomycosis is caused by Coccidioides immitis. It is endemic to the American Southwest and northern Mexico. It lives in the soil, and then when we get these really windy days or these haboobs that we have, it can stir it up, and then we can breathe it in. Blastomycosis is caused by Blastomyces dermatitis, and it is common in the Mississippi Valley. Typically, there aren't symptoms associated with it, but it can spread from the lungs to the skin and cause cutaneous ulcers that can lead to tissue destruction. Pneumonia can be caused by bacteria, fungi, protozoa, or viruses, and pneumonia is an acute infection of lung tissues and the alveolar spaces. It's named for the portion of the respiratory tract that it infects. So, for example, bronchopneumonia is named for the bronchi and the alveoli that are affected. Symptoms typically include fever, cough, acute chest pain, and respiratory distress. When we talk about bacterial pneumonia, we're typically looking at the cause being Streptococcus pneumoniae. This leads to what we call pneumococcal pneumonia. Children, elderly, immunocompromised individuals are at highest risk, and even when treated, have the highest mortality rate associated with pneumonia. The majority of the time, the infection is caused by Streptococcus pneumoniae, and we don't typically see permanent damage of the lungs with that. And the spleen is our friend in this case because the spleen plays an important role in an individual's recovery from pneumonia because it removes pneumococci from the bloodstream. Mycoplasmal pneumonia is caused by Mycoplasma pneumoniae, and it doesn't grow under the same conditions as other pneumonia-causing bacterial species. It's frequently misidentified as a viral strain, and we typically refer to this type of pneumonia as walking pneumonia. Klebsiella pneumoniae is the cause of numerous bacterial pneumonias in the United States, whether healthcare associated or community acquired. It has a tendency to affect persons that already have diseases such as diabetes, alcoholism, chronic pulmonary disease, and therefore rarely impacts healthy individuals. The elderly are also prone to developing complications due to this bacteria. These bacteria are responsible for necrotic destruction of the alveoli. They can also cause abscesses to form in the lungs, and the sputum that is produced from the cough associated with this pneumonia is typically referred to as currant jelly sputum because it's very thick and red and it has blood in it. These bacterial cells are more virulent because they're surrounded by a gelatinous capsule that protects them from being phagocytized. They can also cause a milder respiratory tract infection such as bronchitis or bronchopneumonia. A chest x-ray is how we're going to diagnose it. Pus can also be present there. We call that empyema. Now, those with alcoholism constitute approximately 65% of the individuals that develop pneumonia from the Klebsiella. Mortality rates can be as high as 50% and approach 100% in alcoholics with bacteremia, and it's highly resistant to antibiotics, so it's really difficult for us to get rid of. Pseudomonas aeruginosa pneumoniae is most often occurs in patients, again, similar to Klebsiella, that already have some pre-existing conditions such as pulmonary disease or congestive heart failure. Those with cystic fibrosis are prone to infections with Pseudomonas aeruginosa. And once established, the cells are almost impossible to eliminate. And they are very prolific. They form a biofilm, and this colonizes within the bronchi. And so these individuals are prone to pneumonia and tracheobronchitis, which can complicate their cystic fibrosis disease, and as a result, there's a high mortality rate associated with that. We're coming into the home stretch here. We're just going to finish up our discussion on pneumonia by talking about legionellosis. Legionellosis is a type of acute bacterial pneumonia, and it is caused by Legionella pneumophila. It is a pulmonary form of legionellosis, and it got its name because of an outbreak at an American Legion convention in Philadelphia in 1976. Since then, the organism has been found in hospital water lines, and as a result, facilities engineers have changed the water temperature of the hot water lines to prevent the bacteria from growing. It is also resistant to low levels of chlorine, and water that sits around at lower temperatures should be routinely tested for this bacteria. In regards to symptoms, they're similar to those of other forms of pneumonia. Interestingly, no person-to-person transmission has ever been documented, and it is seen most frequently in elderly men who are currently tobacco smokers or have been tobacco smokers or are heavy drinkers. In severe cases of legionellosis, they have found scarring in the lungs after the primary infection has been taken care of. And this concludes our lecture on the diseases of the eyes, ears, and respiratory system. I hope you found it helpful and just a small bit entertaining.